In Eastern and Southern Africa, what is true is that we've done a lot of work around testing people, putting them on treatment, and the treatment coverage is improving, and that's really great. We've also gotten better at doing some of the biomedical interventions, reaching as many people as possible. But what is not happening is that the decline in new HIV infections, basically turning off the tap of new infections, is not reducing significantly enough to make us feel confident that we're really going to meet the targets by 2020 and beyond. And so what we have found with organizations like yourself, with the evidence, is that the structural drivers of HIV are not being responded to with the same urgency and profoundness as compared to the biomedical interventions. Yes, the biomedical interventions are key, but they must go hand in hand with us trying to understand what makes people, particularly adolescent young girls and women who are lagging behind, and key populations, to understand their vulnerabilities and their risks, and therefore provide solutions to the responses that make the new infections increase at the rate at which they are. At the Strive meeting this morning, most of the researchers and policymakers and civil society people sitting in the room understand the structural drivers that lead to the HIV epidemic in the region. However, the responses to those understandings is not running at the same pace. So, for instance, we understand that sexual violence is paramount, is a key driver of HIV in the epidemics. The interlinkages between violence, gender-based violence, and HIV are very clear, and research has shown that. But when you look at the program development, a lot of the program development in countries still responds heavily around the biomedical interventions, which are very health-focused, without really sort of responding in both prevention and treatment and care for things like sexual violence. So although we have violence centers where women, men, adolescents can go for care and treatment, a lot less effort is being put into understanding and looking at the prevention aspects or reducing that action, which makes women and adolescent girls less likely to do well within HIV programs. So because of the violence, women living with HIV who have experienced violence are less likely to do well on treatment programs, and are less likely to go for HIV testing and know their HIV results. And so the performance indicators for violence as a driver is something that we need to address seriously beyond just the narrative. What programs do we actively and affirmatively need to put in place that allows for the safety and security of the other half of the sky, as the Chinese say? You know, it's not good enough, in my book, to be just talking about giving antiretrovirals and assume that everything else would kind of sort itself out. And so the push for addressing sexual violence, the push for addressing reasons why people find themselves in situations where, you know, they're going for transactional sex because of economics, because of wanting a certain lifestyle, or even just because it's just what there is something that we need to take into place in when we're developing national programs on HIV. And we're also saying that it's not really about HIV in isolation. More and more, as policymakers, we need to integrate the programs that we're developing around people, so that it's not following just HIV, but understanding what the sexual and reproductive health rights of young people are, the confidentiality, the access to family planning, so that, you know, all young people want exactly the same in Eastern and South Africa as they do anywhere else in the world. And I think it's important that as policymakers and funders of programs, that we understand that developing programs with the young people themselves, the adolescents and young women, is key to understanding really what matters to them in their lives on a daily basis. Now, one of the things that Strive and UNAIDS have been working on together is a document around transactional sex and HIV risk from analysis to action. Transactional sex is definitely one of the drivers of HIV in the region and happens for a myriad of reasons. In the past, I think there's been a lot of focus on transactional sex for sex work, but I think increasingly now we understand better, talking to communities and particularly adolescents and young people, that transactional sex happens for a myriad of reasons, wanting a better life, economic reasons, or even just pleasure and seeking a romantic relationship, which is very natural. But within a context of HIV, I think we need to understand that safer sex and giving young people and adolescent girls options within the context that they live to be able to have a good quality of life is essential. And this document, which was done jointly, provides an opportunity for policymakers, program developers, civil society to have focused discussions on the evidence that's been presented, to be able to influence programs, to understand better what communities and people are really asking for. One of the things that I talked about at the Strive meeting this morning was also the increased use of the internet for people, young and not so young, seeking relationships. And those relationships, if are not in an environment where they're safe, can actually be harmful to adolescents and young women and girls. And so I think it's important for us as policymakers to keep on track with what the developments that are happening in our communities and countries, and keep pace with the communication that's happening and where young people are, to understand and therefore develop programs that are relevant and meaningful to them in their context. Young people may not and do not wait to come to health facilities. Young people, majority, are not in health facilities. Majority are out of health facilities and are leading productive lives. They want to be employed, they want to have good relationships, they want children, they want anything else that anybody else wants around the world. And I think that we can only contribute to making a safer place for people by understanding the context in which they live.